Imagine the tones for the station go off. One vehicle car accident with injury. How would you take precautions for someone that just went through a traumatic event and could possibly have a neck or spine injury? The skill I'm about to demonstrate is the technique that helps immobilize a person's spine in the event that they could have a neck or spinal injury. I'm first going to take precautions to isolate from any bodily substances, which involves me putting on gloves. I'm now going to ask my assistant to please take manual stabilization of my patient's head. This involves them placing their hands on the side of their face and neck. I'm now going to test for motor sensory, distal pulse, and motor function of the patient. Ma'am, can you give me your hands? Can you feel this? Pulse is present and normal. Can you squeeze my hands? Can you feel this? You push down like you're on a back hospital. Pulse is present and normal. I'm now going to take and apply a C-collar. I'm going to first measure my patient's neck and then apply the C-collar. Place this piece at her chin and then wrap the back part around her neck. Right. Now I'm going to place the board beside her and I'm going to ask my EMT assistant on 3. We're going to roll her to her side and then place her onto the board. On your 3, we're gonna go. Ready?
1, 2, 3.
I'm gonna then log roll her and place the board right underneath of her. Then on my EMT assistant's 3, we're gonna place the backboard underneath of her and roll her again. Ready? 1, 2, 3. Okay, and when you place her on the backboard, you want to make sure that she's centered. She's a little off, so I'm going to go to her feet, and we're going to push her down and up. On your count. Ready?
1, 2, 3.
All right. I'm then going to take these straps and lay them across to her the way that they would go when we were to actually strap it. One's going to be at her torso, one's going to be at her abdominal area, one's going to be above or at her waist, one's going to be above her knees, and the other is going to be at her ankles. You got to make sure that your straps aren't twisted. All right, so first you're going to want to start at the torso of the person, and you're going to unstrap it. And as you can tell, there's corresponding holes right here. You're going to go under and over. You don't want to do it too tight because you're going to come back. Ma'am, I'm just going to ask you to place your arms by your side for right now, okay? You have to make sure that they're above her and then make sure it's centered at the same time. Then you're going to go to the feet and do the same process. You're then going to tighten this, and then they're going to meet in the middle just like that. And then you're going to continue. And then all the way up, you're going to continue to make sure that it's all centered, all in the holes, and all tight. This is going to make sure that your patient is secured to the board and making sure that they're stable and not going to be able to move to further their back injury. middle. Alright, the next one is going to be her stomach area. While I do this one, I want her to take a deep breath in, and then she's going to take a deep breath out. This is making sure that your patient is getting the right respirations. Alright, ma'am, can you take a deep breath for me? Alright, can you let it out? Good job. Are you doing okay? Alright, and then you're going to go back to the top, and you're going to make sure that her torso is secure. And then back to her feet. She's pretty tight to the board, but if she were to have like an upper back injury or something, you'd want to take towels or sheets and pad any voids that there were to be underneath of there. And then going to stabilize her head. That way my assistant can let go of her head. The first thing we're going to do is we're going to place these blocks on the flat side, not this curved side that you see. So whenever I place this, you can let go. Okay, ready? 1, 2, 3. All right, and then you're going to repeat it on the same side. Ready? 1, 2, 3. Then you're going to take these straps and do the same thing with the corresponding holes. One will go at her chin, and the other one will go at her head. So then you're going to repeat that distal pulse, motor function, and sensory function at the same time. Ma'am, can I have your hands? Can you feel this? Her pulse is present and normal. Can you squeeze my hands? Good job. Can you feel this?
Yeah.
Can you wiggle your toes for me? And her pulse is present and normal. So this is the full backboarding of a person. They say that you should be able to flip somebody over and they shouldn't be able to fall off. The reason why we backboard is so that no further injuries are going to be caused even if there were an accident. If they're complaining of neck or back injury or anything like that, you always want to make sure that you're backboarding because you don't want to cause any further damage for the pre-hospital care. Thank you.